Really excited today to present our speaker, Kristi O'Connor. So Kristi has been a type 1 diabetic for 27 years. She has become part of healthcare by becoming a pediatric occupational therapist. And she is also very involved in sports and was a Division I athlete. She hasn't let her diabetes stop her goals and dreams. And she's here to talk about her experiences from being a patient to becoming a provider in healthcare with various challenges and accomplishments along the way. So feel free, if you have any questions for Kristi, just go ahead and pop them in the question and answer box, and then we'll address them as they come or at the very end. And Kristi, go ahead and take it away.
Awesome. Thanks, Catherine. So my name's Kristi, as Catherine said. I am just going to give you guys kind of an story of how I got diagnosed to like what I'm doing now. So I was diagnosed at 7 years old. And my diagnosis is pretty interesting. So diabetes is not run in my family, so it's not genetic. Mine is autoimmune. So I got diagnosed in March, and then I was very sick in the January before. My dad and I got a very bad virus, and then I started having symptoms at the beginning of March. My parents' routine was like, she's sick, let's give her Kool-Aid, as that was not the best option, knowing that I was about to be diagnosed as a type 1. I was wetting the bed. I was super dehydrated. So I was drinking water, any kind of thing as you would as a 7-year-old. And then again, wetting the bed, which is very abnormal. So my parents took me into our primary care. And they ran my glucose. And I remember standing outside the lab, and one of the NAs goes, "Does diabetes run your family?" And my mom said no. And then I instantly panicked. They took my sister, my dad, and my mom and I into a room, and they diagnosed me. I had no idea what that meant. As a 7-year-old, my response was, "Am I going to die?" It was a lot of education. So basically 20 something years ago, it looks very different than what it does now. So I wasn't in DKA. My blood sugar was 366. So, but they admitted you for a week for education, for diet, supplies, parent education, everything. Everyone that was involved in my life came to the hospital for education, which is amazing. So they allowed me to go home. I went home. I got everything that I did as a 7-year-old to go to the hospital for a week. So basically what happened in that week span is we had multiple providers just providing education. I was not allowed to leave until my parents could do everything independently. I was very independent at that time, and so I didn't want my parents doing my injections, but it was just part of what they had to do to let me go home. And then we had a registered dietitian come in. We had all the representatives come in for different materials that we could have. We were set up for home care. We had nursing home care. We had pharmacy come in, like all that came, as well as when I got discharged home. So again, those resources don't exist anymore as much, but it was amazing as a kid, and more so the parents, because my parents didn't understand like what life would look like anymore, because it literally got turned upside down. So I was hospitalized for 5 days. Once everything was under control, they felt my parents were educated. I had a good handle on things. My parents had a good handle on things. So they just sent me home, and then nursing, home health came in the next day after discharge and kind of followed up with everything. I got home health nursing for about a month weekly, to go over everything with my parents and me. And at that point, technology isn't what it is now by any means. So I was doing injections only, and obviously testing my blood sugar. Pump and sensor didn't exist at that point. So I was testing myself about 5 to 6 times a day, and I was injecting myself about 3 to 4 times a day. Overall, it went okay. Adjusting, my parents were very regiment on diet. I had specific snacks every day. My sister loved it because she got to eat whenever I ate. So she'd be like, hey, don't you need a snack? And I'd be like, yeah. So that was good. I feel like my family adjusted pretty well. My parents, I think, were more stressed than they portrayed to be, which is understandable. At that point, like, it wasn't very complicated. Took a minimal amount of insulin. I was super active. I played sports and soccer, especially since I was 4. So it didn't really, not a lot change except monitoring my sugars, giving myself injections, etc. Then at that time, education looked different. So nursing at school. So I'd go in and test every day at school. If I had a low blood sugar, I would tell my teacher and I'd have a buddy come with me just to test my blood sugar, give me whatever I needed. They were great about it without having to do all these complex things as you do now with like 504s and IEPs and stuff. So it was great. They were super supportive. I did not like the attention. That is like one thing I'll talk about in a little bit is I didn't want the attention. I didn't want people to know. If you asked me 10 years ago, I would never have done a talk like this because I just don't want people to know. I didn't want to be different. I didn't understand. So throughout my childhood, I played club soccer. I traveled. That's what I did. I monitored it pretty well up until I became a teenager, and it became like a battle with my parents of I'm independent. I don't want to do this. They pushed obviously for me to test and do those things. Yes, of course I gave myself injections, but I refused to test. It was like a daily battle with my parents, arguments all the time. So I didn't want to do it. They were doing what was best for me, but I thought I knew what was best for myself because I'm a teenager. It was a hard time for my family, but I was healthy enough that it was okay. And who knows what the effects will be later. But right before I got my pump at 15. I had 2 hypoglycemic events. One of them, my mom woke me up in the morning and I was very out of it. She didn't really know what was wrong. I wasn't responsive, but I was breathing. So she drove me to the ED. I don't know at what point what happened. They gave me blood sugar. Anyways, they did some workups. Everything came back. So like, okay, she was just like hypoglycemic seizure or something like that. Another one happened. I was actually in the shower and I collapsed. My dad found me. So we had a glucagon at that point, and so he injected it. I remember a couple spurts of that event because my dad gave me the glucagon. I remember going in the ambulance and all those things. Long story short, I came from a small town, and so research and diabetes and all that was not common. So it led to them thinking I had a brain tumor. So I wound up having to go to CHLA, which is a children's hospital in Los Angeles, and do a lot of imaging on my brain. Obviously, it was negative. But just looking back at it now, seeing how much knowledge and stuff has changed compared to what I see kids get diagnosed every day here at work to what it was then, like that would never have been on the table. Just because the knowledge is there now and a lot of resources and stuff are way more common now. So that happened. Obviously, all my scans were clear. They ruled out everything. And so at 15, my parents pressured me to get a pump. I had no idea. I thought it was something that was internally inserted. So I had no idea. I was very resistant. My dad was actually the one that pushed it. And I was like, no, I don't want to get surgery. And my dad's like, you don't have to get surgery. So at that point, I had a good endocrinologist and we went over all the things and I got one. So I was with Medtronic. I've been with Medtronic this whole time until Dr. Bassina, but got my first pump. Everything was okay. I was still being my teenager self and not testing. But I liked it. Again, I was hiding it. I didn't want people to know. It was manageable at that point. I would take my pump off to play sports. And I was working out enough that I didn't need the insulin during that time. So it wasn't an issue. because I tend to go hypoglycemic when I worked out at that point. So it was fine. I played through high school. It wasn't an issue. And then it became an issue when I went to college. So I got recruited and I played D1 soccer. And the older I got, the more my body wouldn't respond to working out and exercise. So I was not going hypoglycemic anymore. So it was then learning to manage at halftime, giving myself insulin. When do I take off my pump? Because I had to take it off. I've had it pulled out. I even had, when I'd remove the pump, but kept the site in, it would get pulled out. And so it was trying to manage that. I had a really hard time because my body doesn't respond to things very consistently. So I did that through college. It was rough. I had times of illness. They were out for a bunch of different things like valley fever, just because my body was changing and didn't know kind of what to do. I think a lot of the stress with playing college soccer and going to school and all that. But I managed, like I still play soccer to this day. And then managed that. The pump did okay for me. But the biggest change for me was when I got my sensor. So I got my sensor before grad school. Again, all this kind of evolved as I've been a type 1 diabetic. This was never a thing a while ago. And I feel like that has been the biggest change for me. The sensor obviously is easy. I was testing about 10 to 12 times a day. Before my pump, I was injecting myself about 8 times a day. Just because of my diet, working out, I was up and down so much. And then changing the insulins throughout all this and different insulins coming on the market, and having a good endocrinologist is very important. I've had multiple, I've lived in various states, and I think having an endocrinologist that follows your care and kind of gets your lifestyle and those kind of things is very important. So that's what I found to get my pump. She was a very big advocate about it. Again, I didn't want to wear something else on my body. I didn't want people to recognize that I had something different. But I was like, at the same time, like my pinkies were getting worn down. That's all I would test is on my pinkies. So I got a sensor. It wound up working fine with Medtronic. I kind of grew with the sensor kind of thing, and then getting obviously the inner loop. During all this, I was going to OT school. I wanted to get into healthcare. I was a kinesiology major, and so I was like, I don't know what else to do, and so I went into healthcare. I didn't want to be a PA, NP. I didn't want to go to medical school. So I just wanted something to help people. My passion's kids. And I was like, why not be an OT? We kind of do everything. So I've gone through OT school, and I kind of like got myself my management of my diabetes better. And then I moved to Oregon, and I did travel therapy up there. And so I met an endocrinologist that literally was amazing. I am not the best compliant type 1 diabetic. Like that is, I'll be very transparent. I do my best. I eat well, I work out, I try to do all the things I can, but also I'm human. So she was great. I feel like she actually understood me and didn't give me pushback, even though like I've been on the other end of being a provider, and it can be super frustrating when your patients aren't carrying over everything you say and stuff like that. So I get it from a provider standpoint. But she was great. She was very understanding, and kind of just like went through everything with me of lifestyles and all that. We'll come to find out she was one of the best endocrinologists I ever had because she's a type 1 herself. So I think she understood it more, and understood what it was like to kind of go through the daily things, as well as working in healthcare, being around people, being active, transitions. So all of that on top of moving, I'm a very stressful person. And so that plays its own toll on diabetes with stress, emotions, anxiety, all those kind of things. Obviously I have Dr. Christina now, she's awesome. But I think my journey in all this has like helped me to understand, like I work in healthcare now. I work with pediatrics at Stanford, and I see the worst of the worst. I've seen families who've had 18 months old who have been diagnosed with type 1 diabetes. And I've just talked to the family being like, it's okay. Like, I think as a parent, you don't understand what that means. It's very overwhelming. It's like, you have to test their blood sugar, do this, do that, manage this for the rest of their lives. So I think as a parent, it's more overwhelming than actually for the patient. And I feel like my parents can say the same. But just talking to families that I've not necessarily seen for OT, but I've had them just to talk to them and just saying like, everything will be okay. It's a lot. It's a transition to life, but what we have as resources has made things so much easier. And I think parents are more receptive to that because I've been through it. My parents have been through it. I'm lucky to not have, knock on wood, any complications with anything. So I think that's been a blessing. I'm also aware of what this looks like when I was diagnosed at 7 and potential repercussions. And that's because I work in healthcare. But I also know how important it is to take care of yourself and be proactive and do those things and find providers that are good, that will give you resources that will help you, but also understand that you're a patient at the end of the day as well. So I think like my main thing with all this is like, I think as providers, as patients, as kind of whoever you are, we all tend to not want to be as open about things. And I feel like the more I've been open about things, the more I've talked to people, the more people have opened their eyes of like, oh, like I have coworkers here who didn't know. I've been here 2 years, who didn't know I was a diabetic. I'm not one to talk about it, but I'm also like, you can see my pump on my arm. You can see it on my leg. Like, you can see it now, and I'm okay with that, but I think it's also knowledge is power. And so kind of giving those families experiences, like I've had multiple families ask me like, hey, what's on your arm? And then it's led to conversation. And one of them was actually type 1 herself. So I think talking about these things is very important, and coming and bringing in light to these things is important. And understanding that life is going to be okay. I think it's hard. And there's definitely days that my family in particular and myself, like I have cried, I have been frustrated, like I do my best and there's always something. But being perspective of, I work at a very sick hospital and there could be a lot worse things. I'm not saying it's not hard, but I have a healthy life. I can do what I want. Yeah, like going to work out, going to start a new job, going to see friends, like everything affects my diabetes. But it's like, I think it could be a lot worse when I see what I see here. But again, I think it's amazing. I think education is important. I think talking to people about it, giving knowledge. I don't know. I just want people to feel accepted and different, and whatever they need to make it more normalized, because I think the way diabetes has progressed in knowledge and technology and medicine has changed so much in the 27 years I've been diagnosed that I think it can continue to grow, but we need people to talk about these things to be more knowledgeable. So does anyone have any questions?
Thanks for the presentation, Kristi. And yes, if anyone has any questions, please feel free to put them in the question and answer box. And Kristi, for me, it was just a really great story. I think very scary for sure, being diagnosed so young and going through that experience. And sounds like from your town, they didn't know what was going on, and having to go through all these healthcare hurdles to really figure it out. And yeah, leading you to where you are today. And I think it's a very unique opportunity for someone who you work with and one of your patients who are newly diagnosed to get to work with you, because very related.
For sure.
Okay. We do have a question. How did people react and how did you handle it? And I think this person is maybe referring to maybe how did coworkers or patients react? How did you handle it?
So I think that has made it positive, is that people react like, oh, I thought people would react like it's a big deal. People don't care. more than anything, I've had people ask me to teach them about it or show. I've had friends who be like, can you show me how to put your pump on? Can you show me how to do injections? So I think that's what's made it okay for me to be okay with it, is people don't treat me any differently. Like, I play soccer. People see my pump and sensor every single day. Yes, of course, people look and are like, what is on her leg or what's on her arm? But no one has ever been negative, and more so people have just asked, which I think is very positive, of like, what is that? And so I don't know, I think it's been positive, and it's been definitely eye-opening for me.
Thank you. Anyone else have any questions for Kristi? While we're waiting, I do have one. I'm wondering, due to how you were diagnosed and the resources that were available when you were younger and what you see today and available resource-wise for newly diagnosed, is there anything you think is very beneficial that they do today that you wish you might have had, or something in the past that you wish they carried forward?
I think I had more resources at that time. Like, now you don't get admitted for, unless you're in DKA, or it's like complications or something like that. But I think I'm thankful for the resource I had. You don't get home health and those kind of things when you're diagnosed anymore. I think the only thing that I wish I had when I was younger was a pump and a sensor, but that's not where technology was. So I feel like now it's technology is more amazing. So.
Definitely. All right, next question. Are you using Medtronic for your pump? Are you looping? Have you tried Afrezza or tried any other continuous glucose monitors? Several different types of insulin.
Yeah, so I use Omnipod now. This has been since Dr. Vecina. I was Medtronic for whatever, 26 years. So I've known Dr. Vecina for almost a year. So I've had my Omnipod probably probably like 6-7 months. And then I've used Dexcom throughout all of this. I've tried the inner loop with Medtronic. I absolutely hated it. The pump never stayed on me, especially when I worked out. It was just not something that worked for me. And Dexcom is my favorite continuous. I love Omnipod. I like not having something attached to me, but I also know it's a phone, but I love it. Like, I would not trade it to go back to Medtronic at all. I just started a new insulin. Oh my gosh, I don't know the name of it. It starts with an L. It's from Dr. Vecina. So it's basically the fastest acting on the market. A lot of people have different responses to it because it does have a burning sensation. I like it. I don't have that burning sensation, but it's very reactive and very quick. So that works best for me because I'm not the best at bolusing before a meal. So it works pretty quickly because I usually bolus when I'm eating. So it's been effective for me. And I just started that probably a month ago.
And then someone is asking, as a parent, how are pediatric patients diagnosed? Are there any symptoms that parents should look for?
Gosh, I don't know what it looks like now. Obviously my symptoms were dehydration, urinating. I'm pretty sure that's still common symptoms, like it hasn't changed. But I also don't have the looks for young babies because I know babies are getting more diagnosed. And it depends too if it's autoimmune or is it genetic. So again, a lot of the autoimmune, you're going to virus or something previous, and then it's going to lead to that autoimmune response. So I don't know what they do to truly diagnose nowadays. I just see patients on the end of after they're diagnosed, so I'm not too sure.
Thank you. Someone else is asking if you can explain your experience with Omnipod.
Yes, so Omnipod this is my Omnipod phone, literally. So it's all controlled through the phone. Dr. Bassina has programmed my carb ratio, my sensitivity, all those kind of things. So it works as a pump, except it is not, there's no cord or string or anything attached. So it's all via Bluetooth, hence why the phone is separate. It's on my arm literally right here. So it's not attached. It's waterproof. I work out in it. I'll go for a run and I don't take this with me because I won't need insulin. So you can set it to activity mode and it'll decrease your insulin during your workout. But I have my phone, which will then read the blood sugar through the Dexcom.
Great, thank you. Looks like those are all the questions so far. Any last questions? Feel free to put it in the box. Okay, so someone's asking, can you explain on okay, so I think this person wants more explanation on Omnipod. Whoever is asking the question, can you clarify which part you would like a explanation on? And also don't worry, if it's something that you missed that Kristi talked about, this is being recorded and will be on our Stanford Health Library and YouTube channel. Okay, so maybe just a brief explanation of where it's located, how it works.
Yeah, so the Omnipod can be placed. Basically, the requirement for the Omnipod is you have to have subcutaneous, so fat somewhere. It has to be on the same side as your continuous glucose monitor, so your CGM, because it has to be able to signal to it to communicate. So perfect example, I'll show you guys. So mine is connected to my, oh, you can't see it. Okay. So anyways, it shows, oh, there you go. On my phone, the Omnipod connects with my Dexcom. So that's literally my blood sugar right now. So it connects because it's an inner loop. So if I'm starting to spike high, I'm starting to spike low, the Omnipod adjusts itself as it's been pre-programmed by Dr. Bassina. So you don't have the highs and lows. So it's continuously keeping that range that Dr. Bassina has set in my Omnipod. So basically it's reading all the time and then giving me insulin throughout the entire day. And then every time I eat, I obviously bolus as you would with anything else. Site-wise, I wear mine typically on my abdomen or basically my biceps, not biceps, triceps. You can wear it on your legs. You can wear it, I don't know, some people wear it on their low back. As long as there's extra kind of fat tissue, you can, and there's a good signal with your CGM. People wear them in very interesting places, but as long as it's getting a read, it should be okay. So those are just places I wear it because I think it's most convenient and most comfortable.
Thank you. All right, looks like those are all the questions. Thank you again, Kristi, for your time and for a wonderful presentation. It's always really great hearing perspective coming from someone who is living with type 1 diabetes and also has the unique profession as a healthcare provider. So thank you. And thanks everybody for attending. And again, recording will be up on YouTube and Stanford Health Library.
Thank you.